So after you guys watch the video, you guys might wonder why we need to donate our blood for someone. Here, let me explain. The reasons why we shouldn't blood is because blood is needed to save life in time of emergency and to sustain the life of those with medical conditions like leukemia, thalassemia, and bleeding disorder, as well as patients who are undergoing major surgeries. Blood donation is a community responsibility. While you guys are watching this video, a local patient needs blood. Blood is needed every 2 seconds. About 1 in 7 people entering a hospital need blood. Blood is always needed for treatment of accident victims, cancer patient, or surgery patient. Blood cannot be manufactured. Therefore, Ministry of Health Malaysia has targeted to recruit at least 5% of Malaysian population to become blood donor. Though the target is yet to be achieved, the total number of donations has been showing a steady increase over the years. All the efforts and objective in supplying enough blood for patients will not succeed without the help and support by the general public. Awareness among public is important should we want to make blood donation a public responsibility and a part of our life and culture. Our blood supply comes from caring donors like you. It takes about 1 hour of your time. When you give blood, it gives someone another smile, another hug, and another chance.
14th of June is marked internationally as World Blood Donor Day to promote public awareness about the need for safe blood and blood products such as whole blood. This day is honored by the heartwarming action of thanking each donor, which is part of the WHO campaign. Why is it important to donate blood? Donate your blood can save life. For example, patients who need to operation due to accident, require surgery, cancer treatment, or blood transfusions due to traumatic injuries benefit from the blood donations. Your blood donation will help the person in overcoming their critical condition and regaining a fresh start of life. It represents not only a helpful and responsible gesture to the person in need, but also society overall. However, some people feel that donating blood is dangerous, but what they don't realize is that it is surprisingly essential, like lowering cancer risk and can burning your calories.
You are proceed to the category that can give the blood donation. Of course, blood donor has a category. You must know about the category before you can give the blood donor. So the type of category is age, which is between 18 to 65 years old. You know, some countries permit 16 to 17 years old that they fulfill the physical and hematological criteria required. Some countries also give over 65 years old if their condition is good, and also some countries limits until 16 years old. Okay, next is weight. Weigh at least 50 kg. Some countries also leave people who start 55 kg too. And your health. You must be in a good health if you want to donate the blood, and you cannot donate if you have cold, flu, and others. Then, when you travel is to area that where is mosquito-borne infection are endemic. Lastly, you must not have HIV, which means when your body is negative of HIV, sexually activity in the past 12 months, and you must not take a drug. If you take the drug, you cannot donate the blood. Okay, so that's all for the category of blood donation.
Every 2 seconds, someone in the US needs blood. That means the Red Cross must collect more than 13,000 donations every day. Did you know you can give 1 superpowered blood donation that may have the same impact as 2 regular donations? Here's how it works. Blood is drawn from one arm and sent through a cell separator. Your platelets and plasma are then returned to you along with some saline. When you are done, you will have donated nearly double the amount of red cells given during a regular blood donation, the blood product most needed by patients. It takes about 30 minutes longer than a regular donation, but it has several benefits. You'll likely feel better and more hydrated afterwards. A smaller needle is used, which is never a bad thing. And the best part? You are donating more red blood cells for patients who need them, with fewer donations. Is Power Red right for you? Do you have one of these critical blood types? O negative, O positive, B negative, A negative. Do you meet these height and weight requirements? If so, power up your next blood donation. Make it a Power Red.
Next is the type of blood group. There are 4 types of blood group that we should know before we can donate our blood. The basic that we know is A, AB, B, and O. So then I will tell an interesting factor which known as RH factor. RH factor, which means combine to create blood type, and it can be either present positive and absent negative. In general, the patient can receive blood that has the same ABO antigens as theirs plus O. So RH positive can receive blood from RH positive and RH negative blood, while the RH negative blood only received from RH negative blood only. These are the plan about the type of blood in a specific way. We can see that if you are the type of O negative, you are universal donor, and if you are the AB type, which means AB positive, are the universal plasma donor, which means you can receive from all the types of blood, either positive or negative.
You a universal donor? A universal recipient? The universal red cell donor has type O negative blood type. The universal plasma donor has type AB positive blood type.
Blood transfusion. Blood transfusion is a medical term. Its means is a procedure that used to transfer from one human to one human, which means there are a variety of type of patients that receive blood transfusion. The various components of donate blood are used to treat different conditions. For example, the patient who needs the blood transfusion is who have lost blood due to trauma or surgery or anemia. So, it is important to know about the blood type before we can donate our blood, because a patient must receive a blood type compatible to his or her own blood. If not, red blood cells will slump together and in the potentially fatal situation, or we call that patient will die. Okay.
Transfusion. The doctor will speak to you about the procedure. If you have questions, be sure to ask. When you feel comfortable with the information and your questions have been fully answered, you'll be asked to sign an informed consent form. This form states that you understand the procedure and its risks, and you give permission for your child to have the blood transfusion. If the situation is not a life-threatening emergency, 2 tests will be done before the transfusion: blood typing and cross-matching.
There are so many advantages of donating blood, such as benefit for your emotional and also for physical health, such as reduce stress, improve your emotional well-being, and also it benefit for your physical health. Other than that, the advantage of donating blood is that we can help people with many health conditions such as internal or external bleeding due to injury. We can also help people that have sickle cell disease or another illness that affect the blood, and also undergoing cancer treatment and also undergoing surgery such as cardiovascular or orthopedic surgery. By donating a blood, we can also reduce a risk of heart disease. There are also benefits for the donor, such as donate blood can save the life of people that in need.